How does the body compensate for COPD lung damage? Imagine trying to breathe through a straw that keeps getting narrower. That's what lung damage from chronic obstructive pulmonary disease can feel like. When the lungs are damaged, the body has to work extra hard to keep oxygen flowing and carbon dioxide out. One way it does this is by increasing the effort to breathe. The body signals the respiratory muscles, especially the diaphragm, to work harder, trying to pull in more air despite the narrowed airways. But this extra effort can only go so far because the lungs become flooded, making it harder for the diaphragm to move efficiently. At the same time, the body keeps a close on the blood's acid-base balance. When carbon dioxide builds up because it is not being expelled properly, it causes the blood to become more acidic, a condition called respiratory acidosis. To counteract this, the kidneys step in. They retain bicarbonate ions, which act like a sponge soaking up excess acid, helping to keep the blood's pH within a normal range. This process takes time but is vital for keeping the body functioning smoothly over the long term. Another way the body adapts is by making more red blood cells. When oxygen levels stay low for a while, the body responds by producing extra red blood cells. This increases the blood's ability to carry oxygen to tissues. However, more red blood cells also make the blood thicker, which can lead to blood clots and raise blood pressure in the lungs, a condition known as pulmonary hypertension. This can put extra strain on the heart and worsen overall health. The muscles involved in breathing also change. The diaphragm, which is the main muscle for breathing, adapts by shortening its muscle fibers and shifting toward types that resist fatigue better. This helps it work longer without tiring. But despite these changes, muscle strength can decline because of less oxygen reaching the muscles, ongoing inflammation, and poor nutrition common in severe COPD cases. Finally, the lungs' immune system tries to repair some of the damage through inflammation and cellular responses. While these responses aim to heal, they can also cause further airway narrowing and scarring, making breathing even more difficult over time. In essence, the body uses a combination of increased effort, chemical adjustments, blood changes, muscle adaptations, and immune responses to cope with lung damage from COPD. These mechanisms help maintain breathing and oxygen levels but can also lead to other health issues if they become overwhelmed. Managing COPD well involves supporting these natural responses while preventing further lung injury.